Mike and Alex, back over to you.
All right, let's get into this because the whole country's talking about it. The Trump administration says there is it could be a link between Tylenol and autism. So officials announced yesterday that acetaminophen, did I get that right? The active ingredient in Tylenol increases the risk of autism when it's used during pregnancy.
First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Acetaminophen. Is that okay? Yes. Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good.
Well, he said it, but other experts are saying that they disagree. Instead, they say that it's still one of the safest options for pregnant women when used in moderation.
Dr. Ryan Brannon is a board-certified OBGYN, and he joins us here, obviously. So I know that I've struggled with that word since Tylenol was invented. Acetaminophen.
Excellent.
Did I get it?
You got it correct.
What is it?
Well, it's an anti-inflammatory pain medication that we use very commonly in pregnancy.
And why is it? Because I know for many women, it's what is considered the safest option during pregnancy. Why is it considered safe?
Well, the evidence overwhelmingly has shown the safety over many, many years. Ever since I've started practicing for almost 20 years, we've been using it and it's been safe. You know, other pain medications such as ibuprofen has been shown not to be safe in certain parts of pregnancy, so we've always leaned toward the safer medication, which is acetaminophen.
Oh, say that again, really? Ibuprofen?
Ibuprofen.
Okay. So you say don't take that.
That's the one that we are more cautious with in pregnancy.
So you choose Tylenol over that.
Because we know it's safer.
What's a brand name of ibuprofen?
Advil. Motrin.
Okay.
And so with this then, I mean, the fact that there's, the FDA is saying this and the president speaking on it, is there any evidence at all that there should be some concern?
Well, let me say this. The FDA is not saying that.
Okay.
They're going to add a potential warning that there may be an association, but they're not saying that it causes. And I think that's the big thing that we need to be
right. But
very
that's the
clear
confusing part, because they're kind of going, because here's the quote here. It says, an association between acetaminophen and autism has been described in many studies. A causal relationship has not been established, and there are contrary studies in scientific literature. So for the average person, I'm confused, because it's like, you're saying, well, there's sort of a relationship, but it hasn't been established, but there are, conflicting reports. How are we supposed to take this as folks who aren't in the medical field?
So, I think, you said it perfectly there, there's an association, but there's not a causal relationship, right? So, for example, I can say that two things happen at the same time, and one may not cause the other, right? But there's no evidence to show that Tylenol causes autism, right? So, the example that we talked about in the summertime, ice cream sales go up in the summertime. Unfortunate water accidents like drownings happen in the summertime. It doesn't mean that ice cream causes the drowning. It just means that it's so hot outside, both are happening at the same time. Right?
So is this just one person's opinion?
Well, there's like you said, there's contrary evidence. So there are very small studies that suggest an association, but there are no studies that show a direct link between the two.
But I got a bottle here from down the street. It's at CVS. This is acetaminophen. But it's not Tylenol. It's a generic brand.
It's a generic brand. Tylenol.
But it's still the same thing.
Same thing. It's the same thing. And I think that's what's really important is that it is the safest drug. There is a lot of evidence and many, many years of evidence to show that it is safe. And like everyone is saying, if you have any concerns in pregnancy, fevers, pain, it is very reasonable to use the medication and speak with your doctor as to whether or not that's something you want to do.
Well, two things, because the word association, right? If you're a pregnant mother, of course you want to do everything you can for the health of your baby to make sure everything, works out. So if you are concerned even just by the word association, what other options do you have then if you're having pain or if you want to take something?
Well, that's kind of the concern that we have in the medical field is that we don't really have many other safe options, and this is the safest option once you get outside of more stronger pain medications like opioids.
Oh, how horrible! If you're pregnant and you're in pain and you believe what they're saying, what do you do?
And I think that's the responsibility that we have, is to try and educate our patients and try and lower that fear level, because we don't want patients to suffer through pregnancy. And in actuality, you know, fevers can be more problematic in a pregnancy than taking acetaminophen. And that has been proven.
And when we say in moderation, because that's another thing you mentioned and is being said, what is in moderation? Just make sure you're doing it every once in a while? Like, what would be the threshold?
Well, I think if you have medical indications, like they said, if you do have a fever, if you do have pain, if there are certain circumstances that would require or would benefit from acetaminophen, then you take it according to the label. And it's the dosing is safe. And there's been studies that show there isn't a dose relationship either. So taking a smaller doses versus the recommended dose isn't going to be any different.
Maybe because the word is so hard to say that they just say Tylenol.
Yes.
Because there's other ways of getting acetaminophen other than Tylenol.
Generic brand.
Well, yeah. So Tylenol is just the brand
name
name,
that's easy to say.
the brand name and most popular name for acetaminophen. But many other companies can make the same drug, and the generic name is acetaminophen.
Man, if I was Mr. Tylenol, I'd be upset.
Well, they have put out a response. We want to make sure we put that up.
It's coming. Here we go.
Another dramatic pause.
Yes, there it is.
Tylenol put out, the facts remain unchanged. Over a decade of rigorous research endorsed by leading medical professionals confirm there is no credible evidence linking acetaminophen to autism. We prioritize science as the core of how we provide care, and that will never change. And I believe we also have a statement from the Association of Gynecologists. I don't have the exact term here. Here we go.
That's right, there it
Thank
is.
you. They say today's announcement is not backed by the full body of scientific evidence and dangerously simplifies the many and complex causes of neurologic challenges in children. It is highly unsettling that our federal health agencies are willing to make an announcement that will affect the health and well-being of millions of people without the backing of reliable data. So there you go.
Whoa.
Yeah.
Well, I guess I'm glad I'm not pregnant, because I'm not sure what the heck I would do if I was in pain.
Well, the truth is, autism is multifactorial, and again, like Alex said, there's no evidence that acetaminophen is a direct link, and I think us as obstetricians will continue to recommend acetaminophen when needed in pregnancy.
That's what I was going to ask you next.
Yeah, talk to your doctor and decide what's best for you.
All right. Thank you.
You're welcome.
All right, come right